Again, everyone, thanks for joining us. We will be starting in just a couple of minutes. If you are watching and do not intend to ask a question, you can also watch this live on YouTube on our YouTube channel. That's at boco.org/phyoutube. We'll record this webinar, and you can also watch it on that same page afterwards.
Muy buenas tardes. Yo soy Rosabel, una de las dos intérpretes hoy día, y queremos explicarles cómo pueden ustedes usar la modalidad de interpretación el día de hoy. En un momento verán un globo, van a ustedes escoger ese globo y escoger español o Spanish, y de esa manera van a poder escuchar toda esta presentación en español. Así que muchas gracias, y nuevamente pueden ustedes en un momento ver un globo al bajo de su pantalla que van a oprimir en un momentito. Si están en un teléfono celular, van a ir a los tres puntitos y ahí es donde van a escoger interpretación y luego el idioma, y luego salir, y ya estarán habilitados para escuchar esto completamente en español. Gracias.
Hello, everyone. My name is Chana Gasetis. I'm the spokesperson for Boulder County Public Health, and I want to welcome you to today's community update. As you know, there's been a lot going on with vaccines in particular. So we're going to hear again today from our Executive Director, Jeff Zayak, who will give us an update on the data and where we're headed. And then again from Indira Gujral, who manages our Communicable Disease and Emergency Management Program. And she will talk a bit about vaccines. And we hope to have plenty of time to answer your questions. So right now I will turn this over to Mike, who will give you the background on how this is going to go. Thanks, Mike.
Good afternoon, everyone. Thanks for joining us. I'm Mike Stratton, and I will be moderating the call today. Some quick housekeeping tips to let you know how this will go. After the presentations, we'll have a Q&A session. You can click on the Q&A button at the bottom of the Zoom screen, type your question in, and we will read that for you. If you happen to be calling in by phone, if you can hit *9, we'll see you raise your hand and we'll call on you and you can ask your question in person. If you need to unmute yourself, use *6. For those of you viewing on YouTube, if you do end up with questions, you can send them to healthinfo@bouldercounty.org. Now, I'm going to turn it over to Jeff Zayak, Executive Director of Boulder County Public Health.
Thank you, Mike. I'm going to go ahead and share my screen here. All right, if somebody could just let me know that they can see that.
Yep, looks good.
Great, thank you. Well, welcome everyone. Thank you all for tuning in today. I really appreciate that people are jumping onto the calls and hearing the latest information. I'll also wish you all a happy and safe new year. The good news here is that our data is continuing to look really great, as you'll see as I walk through these slides. We just need to keep it up, especially through this next period of New Year's Eve and New Year's Day, which we know can be a time of gathering. This is the first slide I wanted to share, and this is our overall status in Boulder County. We are placed on the state dial, based on these three indicators right here, which is our 2-week cumulative incidence rate per 100,000 people, our 2-week average positivity rate, and the number of declining or stable hospitalizations in Boulder County. As you can see here, all three of these are in good shape. We are currently categorized in red as severe, but our incidence rate for the first time in many, many weeks is now in the orange level, which is below the severe level. So if we remain in this level for at least 2 weeks, we can request certification from the state to move down to the orange level. So we're doing great. We want to keep this trend headed in that direction. And our positivity rate and our number of days declining and stable hospitalizations are already in that positive level. This is the number of cases in the metro, and as you can see, these cases are continuing to decline. Again, going to reinforce with many of these slides that not just Boulder County, but our surrounding counties are headed in the right direction. This is our 5-day average number of new cases. As you can see, we're on a steep decline here. We're at 79 right now. This is excellent news. We want to continue to focus as we move through these next several weeks. We also have a decline across the county, and what this shows is just a number of cases per municipality. A good comparison I like to show is if you look here towards the September 6th, 13th, and 20th, you'll see that a large proportion of the cases were coming from the city of Boulder. That was associated with what you'll see on the next slide as a spike when the University of Colorado came back into session. We are now seeing that more of the cases are coming from Longmont, indicated in the light blue on this graph. This is the number of cases per age group from 0 to 9 all the way to 75 plus. Again, the positive trend here is that we've been seeing declines in all age groups. We have a slight decline in the 25 to, I can't see the second half of that, sorry. But we do have a slight incline in that one age group that is indicated in blue on here, but all of our age groups are declining in general. Again, very positive, want to keep this up. This is the number of Boulder County residents who have tested positive or considered probable by race and ethnicity. The bottom line here is the thicker the orange line, the worse the disparity that exists. We want to see that we only have about between a little over 14% of our population is Hispanic and Latino, but we know that we have a larger proportion than that of our total population that ends up positive with COVID. We are working as a county and have established resource coordinators and are working with our existing referral networks to make sure that we're supporting all of our priority populations to the maximum extent possible because the disparity, as you can see here, still exists. We do want to see it go away so we do not have disparities moving forward. Our testing is definitely representative of the disease, and the way that we can tell that is the magic number is 5%. So we want to be below 5% in the county. If we're below 5%, that means we're testing enough people to identify the majority of the disease that's out there. If we get above 5%, then it means that we're not quite doing enough testing. We have clearly plenty of testing capacity. If you go to our website at Boulder County Public Health and search testing, you will find that there's ample testing opportunities across the county, and it lists which ones are free and the hours of operation. We encourage everybody to take advantage of testing. What I wanted to talk about here is our hospitalizations. Many people think that hospitalizations are only happening in our oldest age groups, but as you can see here, we have non-ICU hospitalized occurring primarily from 25 years up and older. And even our ICU hospitalizations are occurring from 25 and older as well. So this disease can impact many people of many different age groups, but just want to make sure that people know that this is not just a disease that puts older folks in the hospital. It can put many of us in the hospital. Positive trend statewide, hospitalizations are decreasing. We also have hospitalizations here in Boulder County decreasing, so our trend here is headed in the right direction. This is all good news, and that's important because we are still seeing an increased number of deaths, as you can see here on this chart. This was early on in the disease. If you look at the April timeframe, that was early on in the disease progression, and later we are seeing a larger spike in deaths. Typically, as we see increased cases and then increased hospitalizations, the thing that we see last is our increased deaths. And as our hospitalizations and our cases decrease, we will continue to see increasing deaths. We know that this disease continues to impact our oldest population most severely. The county residents are staying home. This trend basically indicates where people were in the early spring in terms of stay at home and where they are now as of December. So you can see in general, there was a decrease from the early part of this disease outbreak with more people staying home to less than there is right now. But we still are doing better than we were in October. And that is an indication of probably why our cases are staying low, because more people are choosing to stay home. They're isolating from other people. They're not gathering in large groups. They're wearing masks. They're doing the right strategies to help prevent the spread of this disease. So I want to thank all of you who are on the phone and listening, or on the computer and listening, and let you know that we're doing the right things. We just need to keep it up for a bit longer until we have vaccines circulating widely in the community. This is data that shows the number of infections in our community, and this is a little bit dated. It's from 12/7. These numbers have probably improved slightly, both on this slide and the next slide that you'll see. I'm referencing not just county data, but also statewide data. At the time that we looked at this, you can see that Boulder was actually had the best rate across the metro county, with 1 in 262 people that were infectious in the community. And what you'll see here is that when we looked at the data at a statewide level, this was back on 12/14, that there was 1 in 59 people infectious. This number is probably a little bit better now based on the last couple weeks of cases, but that's still a lot of infection in our community. It means the virus is still out there. We still need to take it seriously. And until we have, again, vaccines circulating widely in the community, it's going to be really important for us to continue with those prevention strategies. Just as a comparison, if we look back a couple, 3 months, we would see numbers of about 1 in 800 plus people that were infectious. So just a lot more virus in our community that we need to be worried about. And again, 50% of the people don't know that they have the disease and are asymptomatic. So they're not even aware that they're spreading the disease when they are. Again, get tested. It's free and it's easy. It's not going to be available forever. So we encourage people to look on our website. There's many places across the state that people can get free and easy testing. The biggest thing I want to emphasize here is, again, a thank you, because this is 100% preventable. We wouldn't be having to have debates about masking and about social distancing and about what kinds of policies we need to put in place to restrict gatherings if we simply follow those really important preventative measures. This can't spread when we are not within close proximity to each other, when we wash our hands effectively, and we can prevent this. So thank you for doing what you've been doing. Please keep it up, especially over this New Year's holiday. And please do get the exposure notification app if you haven't already. This helps us because people who are close to somebody who's been exposed to the virus and has been positive are notified that they have been close to somebody, and they'll get instructions sent as a text to their cell phone. And it helps make sure that people are aware that they may be probably exposed to somebody, and it gives suggestions for what they can do to help preventing potentially that spread to others and to figure out if in fact they're positive themselves. So please do go to addyourphone.com and it will describe the program and tell you how to add that simply to your cell phones. So thank you all. Appreciate again you tuning in, and I will turn this over now to Indira Gujral, who is our Communicable Disease and Emergency Manager, Division Manager. Indira.
Thank you, Jeff. Let's see. Okay. Need 1 second. All right. Can you see the screen, Mike?
We are seeing your slide that says vaccine development includes 4 phases.
All right, thank you. So thank you, everyone. Good afternoon. And I'm Indira Gujral. I'm going to talk a little bit about the vaccination planning and some of the progress that we're making with vaccinations. I'm going to cover 3 areas today. One is to update you on the current vaccination planning and what's happening in Boulder County by phase. 2, to kind of share some changes that we learned about just today that rolled out from the governor's office on the phase distribution. And the third is to maybe answer some common questions that we've been receiving at Boulder County Public Health. I first want to just do a shout out to all of the public health staff and the hospital staff and our partners that are federally qualified health centers who've been really working hard over the holidays to make sure that vaccinations start getting into people's arms. And I'm really grateful for the partnership and collaboration from all of you. So thank you. So the first thing I want to do that I always like to focus on is the vaccine life cycle. And the vaccine life cycle is really important because it talks about safety at every phase. And on the left, you can see some basic research, discovery, the preclinical trials, everything that goes into getting vaccines ready for a clinical trial. And once those preclinical studies are done, it moves into a clinical studies or a clinical trial. So often you will read in the newspaper that there's a vaccine in phase 1 development, and it's looking at safety. Phase 2 development, which is looking at effectiveness, and phase 3, which is looking at safety and effectiveness. And all of that data is then submitted to the FDA, which does this full deep review of what the science says. Is this vaccine safe and effective? And once the FDA does their review, they will then pass it on to the Advisory Committee on Immunization Practices. And this group is then charged with making recommendations. Who should receive the vaccine and what age group? So you've probably been reading about some of the recommendations that come out from ACIP recently because they have made some recommendations based on age groups. After the ACIP does their review and vaccines start to be disseminated out into the community, there's always this ongoing phase 4 that is happening. And this is monitoring for safety and effectiveness. And we know that that's important because we want to document and make sure that we understand if there's any adverse reactions to any of the vaccines. So right now we are currently in phase 1A, and this is a picture of Dr. Amy Meditz. She's over at Boulder Community Health. She was one of the first providers to receive the vaccine a few weeks ago. And phase 1A is focusing on these high-risk healthcare workers. And we're really happy to report that almost 74,000 doses have been given out to this phase 1A group in Colorado. Now, just keep in mind, there's about 350,000 healthcare workers in Colorado, so we still have a ways to go. And some of these numbers may be lagging as data is just getting entered. What we do know from talking to our local hospitals is that many of the hospitals are nearly done or complete with the phase 1A in terms of being able to distribute the vaccine. So that's really exciting. In addition to phase 1A are what we call our care facility staff and residents. And so these include people who are living in skilled nursing facilities, long-term care facilities, and assisted living. And this is a whole program that's being managed by the Centers for Disease Control and Prevention called the Long-Term Care Partnership, in which they have contracted with Walgreens and CVS. And those two pharmacies are going out to every long-term care and skilled nursing facility and assisted living across the country, and they're administering all the vaccine to both the residents and the staff. So this is a heavy lift, but we're really excited about it because it takes the burden just off of local public health, and it helps to share the load of getting these most vulnerable individuals vaccinated. We hope to see this done, completed probably by end of January, potentially mid-February, but this is very exciting. And so that kicked off just this past Monday on December 28th. We are then moving into what we call the moderate risk healthcare workers, this 1B group. And 1B is just recognizing that there are healthcare workers that work in both outpatient and inpatient settings who don't have as much of a COVID exposure as those healthcare workers who are working, really closely with COVID patients. And so this includes people from all types of professions. And so right now in this moderate risk healthcare worker group, we are conducting some outpatient healthcare worker vaccination clinics. So at Boulder County Public Health, we started a clinic last week. We got the vaccine Tuesday morning and we administered it Tuesday afternoon. We're really excited about that. And we actually held a clinic today where we are giving out almost 400 doses to this 1B group. We are also in talks with Safeway to do a pharmacy vaccination to help support our 1B group getting vaccinated. And our first responders who are part of this 1B group are also getting support from our local hospitals. So we couldn't do it without all of them. Now, one of the changes that I wanted to point out on the right side in the box is that there is a new inclusion to the 1B group. There's a few new inclusions. One is that third bullet down, which is people over ages 70 and older. And that was a recommendation that came out from ACIP. And so we are going to start planning on what that will look like because it just came out today. So we don't have answers yet. And then under the dotted line also is an inclusion of frontline essential workers. So these are people in the education field, food and agricultural workers, people who work in public transit, grocery and grocery store workers, and public health and direct care providers for people experiencing homelessness. Also includes people in the executive, legislative, and judicial branches of state government and essential frontline journalists. So what we've been told today, and we'll have more information soon, is that we really can't go below that dotted line until we've completed everybody above the line. And just to give you a sense of what we're looking at in terms of numbers, I believe it's estimated that we probably have between 20 and 30,000 people in Boulder County that are ages 70 and older. So we definitely have a lot of work to do. So these new phases of 70 plus, individuals 70 years of age and older, and teachers and essential workers, is we're going to have to do a lot more planning. And as those plans come to fruition, we'll be able to share through this venue and through our website and be as public as we can about what those plans look like. Obviously, that's a lot of people to vaccinate, and so we're going to have to come up with a multi-pronged approach. So more to come next week. And just also to keep in mind that we are very limited on the doses we get. So a lot of this is also we can have the best plans made, but it's also going to be dependent on how many doses we're actually going to see. So by phase 2, we're looking at a springtime where we'll be looking at these high-risk individuals and other essential workers. We'll be looking at individuals who are in that 60 to 65 years of age, and those who are between 16 and 64 with underlying health conditions. And I'm going to go into that in just a second. This also includes direct interaction with the public, working in high density areas, and those who might have participated in a COVID vaccine clinical trial and maybe been a recipient of a placebo, meaning that they did not receive the vaccine itself. So some of the health conditions that we are looking at include people who might be prioritized just based on their risk for, that they have diabetes or a chronic lung condition, or they might have obesity or significant heart disease or kidney disease and cancer, being compromised in their immune system. And the reason why this is important is that the research has strongly shown that individuals with these underlying health conditions are more at risk for death and also for morbidity, meaning that they could be sicker for longer. And so we want to make sure that we have them covered. Okay, so some of the phase 2 considerations that we have to think through, and we're waiting for a little bit more guidance on this, are how much vaccine do we have? Because we know that phase 2 is a fairly large group. It could be upwards of 2.7 million people in Colorado. That's a lot of people. So we're going to have to think through, how do we take the vaccine that we have and prioritize among those groups? And we have some priorities, but we have to think through, how much vaccine do we have? What's the transmission risk? Are these individuals interacting with the public? Are there group living situations? And then those comorbidities that we talked about. And then by summer, it's our hope that by summer, the general public, all those who are healthy between 18 and 64 years of age, will have the ability to access the vaccine. So if you want to learn more information, I highly encourage you to go to the state health department's website. They have some really great slides on keeping up with the data, how many doses are being administered. It's kind of fun to see that, there's a lot of movement in this vaccine era and in just a few weeks. The other thing is that if you have questions, if you have, not sure if you want to get the vaccine and you have some hesitancy, you can always call the CDPHE call center. Vaccine is definitely very effective. So this is one of the questions that we've been getting regularly is, well, what happens if I get my first dose? And what happens with my second dose? Well, the Pfizer data seems to indicate that after the first dose, you have about 52% effective of protecting from COVID, but it's that second dose where you receive that 95% effectiveness. So you definitely, if you get a first shot, you need to make sure that you get that second shot, because that's really what's going to protect you. Pfizer effectiveness occurs 7 days after the second dose, and Moderna is 14 days after the second dose. Immunity definitely takes a little bit. So you have to continue wearing your mask and social distance. And people always ask, well, why do I have to continue wearing my mask even if I got vaccinated? And that's because you can still potentially transmit the virus and you can be exposed potentially and actually transmit the virus and not even know that you have it. And so that's why you're going to be asked to continue wearing your mask and to continue social distancing so that you can protect others and those around you who potentially don't, and you may not even know that you might be infectious. All right, so the other things to know is that the vaccines will definitely not cause a positive PCR test. So this was a question that came up, is will I be positive for if I go and get like a PCR test, will I be positive for that PCR test because I've gotten the vaccine? And the answer is no. But it is possible that you could be positive for an antibody test because your body is building those antibodies to protect you from COVID. One thing that you should consider is if you've had COVID, consider waiting for 90 days to get the vaccine and offering that vaccine to others. So when you've had COVID, we know that you have built immunity for up to 90 days. And so we just think that it's important, if you can wait and have someone else get that vaccine. One of the other questions that came up is what happens if I become ill with COVID in between my first dose and my second dose? And what we would say is if you're up to the time period where you're supposed to get your second dose and you're sick with COVID, you would not get the dose. You would wait until your symptoms have resolved and you finished your isolation period of 10 days, and then you could get your second dose. So what are the side effects? A lot of questions that we get about side effects. So the side effects are sometimes things like pain and swelling at the injection site in your arm, possible fever, chills, or tiredness or headache that you might get for 12 hours up to 24 hours. And it's very rare that we've seen 0.4% of clinical trial participants experience a serious adverse event. But for the most part, the side effects mean that your body is actually doing what it's supposed to do, which is building protection and antibodies to help protect you from any type of future exposure. They also have, when you get your vaccine and you get your immunization, you'll be given a card and it'll tell you when you're going to go for your next shot. You'll also be given a document to sign up with the CDC's Be Safe, Vaccine Safe. And basically you can report any side effects to them. They want to monitor you. If you sign up for them, they will also periodically ask you questions like, how are you feeling? How are things going? And it's all part of that phase 4 monitoring. They want to know, how are things going? And we're trying to make this as transparent as possible. So they'll be collecting that information and then sharing that back out. We just want to encourage everyone. I know that, people might be a little bit nervous or a little bit hesitant, but talk to your provider, talk to any friends that might have been vaccinated, call that co-help number and talk to someone on the phone, because if we all get vaccinated, it's really going to help all of us get back to staying open with our businesses and our schools. And it's going to give a lot of relief to our healthcare providers. And obviously, it's really important for us to get vaccinated to save lives in our community. And we've lost lives this year, and it's been really sad, I think, for everyone. And we don't want to lose any more lives. So encourage you all to seek information if you have any concerns, and can really highly consider to get vaccinated. And as Jeff said, COVID is still with us, and we need you to stay home. That means no holiday parties for New Year's Eve. Have your own dance party at home, have fun at home, but really try to stick within your own household, because that could really spread the virus more. And you've seen that happening across the whole country. So, all right, that's it from me, Mike. Thank you so much.
Thank you, Indira. We are now going to open up for questions. We will answer as many as we have time for and from as many people as we can. Our presenters are approaching these topics from a place of respect. We ask that you please do the same. If we don't believe that's the case, we might have to mute someone. We'd like to not have to do that. To ask a question, if you're on the Zoom call, on the bottom of your screen, you'll see the Q&A. Click on that, type your question in, and we'll read that out loud. If you're on the phone, you can push *9. That will raise your hand, and we'll call on you to ask in person. Along with our two presenters, we have some other people here with us to answer questions today. They are Dr. Chris Urbina, Boulder County Public Health Medical Officer, Emily Payne, epidemiologist with Boulder County Public Health, and Kate Hayward with the County Attorney's Office. So let's get to these questions. First one. I am pregnant and interested in participating in a clinical trial. Are there any trials available for pregnant women in Boulder County?
Chris, I can answer if you want. I'm not aware of any, Chris.
Yeah, I would encourage the questionnaire to go to the CDC website. They're listed there in terms of their clinical trials, and they'll query you if you're interested, and then they'll give you a location or a number to call regarding the sites that are available.
Thank you. Next question. What does this new strain we've been hearing about that is more contagious being found in Colorado, what does that mean for us?
I'm happy to take that one, Indira, or you're welcome to.
Yep, go for it, and I'll add on.
Okay, This is obviously, this is an interesting question for a lot of people. All viruses mutate. So it's normal to have variants and mutations. This one has gotten a lot of publicity because it was first discovered in the United Kingdom or in England. And because it was causing a significant number of cases, 60% of the cases in England were due to this new strain. So far, what we know about this strain is that it probably increases the infectivity, probably 60% of the, 50 to 60% greater infection rate with this variant or a mutation in the virus. But at this point, it doesn't cause any more serious disease. The current treatments that we're using for COVID-19 are effective with this. And all research at this point shows that the vaccine that we're using is probably going to be protective. But each of the vaccine companies, including the ones still in development, are testing it against the new variant. All of that said is that that's what we currently know. Over time, we'll know more, but and the United States through the CDC is now increasing their surveillance. It's quite a surprise that we actually discovered this in Colorado, but my guess is that because our surveillance was largely low, it was here and we just didn't detect it yet. So at this point, the current treatments, the current vaccine, it doesn't cause more serious illness. At this point, we think that it's okay to have, and it doesn't need to have any increased worry. The same protection habits that both Indira and Jeff talked about, wearing a face mask, physical distancing, washing your hands, avoiding large groups, not traveling, not going to work or school when you're sick, all will protect you against this variant. So that's all good news. So I'm not saying don't worry about it, but I think that the risk is not any greater than the current variation that we see. Happy, Indira, if you want to add anything to that.
I think that was perfect. I think the only thing I might add is we're learning more all the time. And it's very possible that we might need a higher percentage of people to get vaccinated because of this variant, because of the transmission. So just really encouraging you, if you have the opportunity to get vaccinated, please get vaccinated.
Okay, great. Thank you. Next one is probably for Emily. I've got a number of data questions from Alex. I'll ask a couple. If we got time, we'll come back. We'll see. We've got quite a few questions out there right now. He says, like many residents, I really appreciate the community meetings and the Boulder Health website. Hospitalizations seem to be a key parameter, and you currently show a number of people currently hospitalized and discharges. Can you show admissions similar to what CDPHE does? Also, since your hospital data includes all patients in Boulder County hospitals, regardless of their county of residence, can you give us a ballpark estimate on how many of them are outside Boulder County?
Thanks, Mike. So sure, I can definitely answer this one. As you mentioned, this is definitely a key parameter, and that's part of the reason we have that specific hospital dashboard. One thing I will bring back to the team is the idea of putting admissions on there. I hadn't even thought of that. I don't lead that dashboard, but that's a great idea. So I'll bring that back to the team and see if we can get that added on there. In terms of that data source, it's actually anonymized. What we get out of that is a number given to us by the hospitals. So it's not really possible for us to tell, any demographic information, including the residence of the individual from that. However, if you look at the CDPHE COVID dial page, you can go to the hospitalizations metric, and that will give you an assessment of how we're doing in terms of our actual residents, how many days of decreasing or stable admission Boulder County residents are having, regardless of where they're hospitalized. So it's a separate data source that looks at information on hospitalizations by where the person lives versus the data source we mainly use looks at the hospitals themselves. And I would say that looking at the hospitals themselves is important because we know that hospitals in our county are important to look at our own capacity. And so even if people from other counties are taking up our hospital beds, it does matter for our capacity as well.
Thank you, Emily. All right, next question. This is probably for Jeff or Kate. Is Boulder County or the state looking at making the vaccine a requirement for businesses to reopen?
I'm happy to jump in on this. This is Jeff. And we are not looking at it as a requirement. It's a new vaccine. We are strongly encouraging it. I think you will see that across the entire state. There is a campaign out there now for making sure that people are aware of the vaccine, that it has gone through approval, and that we're encouraging people to do it. But there is no conversations at this point about mandating it.
Thank you, Jeff. A general question here about vaccines. From Ben, headlines today are extrapolating that at the current production rate, it will be several years before the general public will be fully vaccinated. Is this accurate? What kind of timeline can we expect?
So I'm happy to take this one. I think that there are some definite logistical challenges in recognizing that the vaccines have to be managed very differently. When you provide and you give out a vaccine, you have to do a lot of observation of people who have received the vaccine to make sure that they're not having any side effects. So it's different than when you say get your flu shot. It's a different type of approach. I'm not sure it's going to take that long, but I do think that one of the things that we've been waiting on is for Congress to pass the bills to support vaccine funding, because it's really important for us to staff up and ramp up. So I think what you'll see is as Congress passes that funding, as local public health agencies who are responsible for a lot of the vaccine planning and administration, along with their partners in hospitals and healthcare settings, as we get more funding and we can get more people and more staff, we will see more vaccine being distributed. So I don't think it's going to take that long, but it might take longer than we originally anticipated as a nation.
Thank you, Indira. I've got one more quick one for you on vaccines. What if you're positive but don't know it and get the vaccine?
Chris might be able to add in here, but one of the reasons why we don't have people who are COVID positive getting the vaccine is because if they do have side effects, we won't know if the side effects are from the infectious disease itself or from the vaccine. Anything else to add, Chris?
It certainly will cause no harm. I mean, it will boost your immune system a little bit, because we don't know how long the immunity is going to last from the infection, the natural infection. So that extra dose of the vaccine will further stimulate your immune system to produce all the neutralizing antibodies that you need. But as Indira said a little bit earlier, we're still learning as we go along. And so we're monitoring the effectiveness of this vaccine. We're monitoring the natural history of this disease. And as we learn more, we'll be sharing more. I wish we knew all the answers to all these questions, but we're also, as public health and as scientists, as health providers, we're learning a great deal as we go along.
Thank you. This next one is for Jeff. Please explain why Boulder County Health says we do not qualify for the 5-star program. I don't think that's actually quite accurate. When other counties in our area with worse metrics on the state dial have been applying and been approved by the state, what exactly does the county need to do to qualify?
Yeah, we actually, when we sent out I think you're probably referring to the press release from a week or so ago. And at that point, we did not qualify. What it takes for a county to be eligible from a data standpoint is if the county has had a 2-week sustained decline in incidents, hospitalizations, and a percent positivity under 10%, or improving over the last 2 weeks. So we do actually qualify now. There is a group that has been working in the county to set up a administrative committee and to apply for a variance. And I don't think there's anybody on the phone relative to folks that have been working on that group, but there is a group working on that now.
Thank you, Jeff. We have a number of questions, specific questions about what to do with their family members, et cetera. And I think Indira has touched on this, but can you tell us if people want to know what's going to happen, where they fall in the group 1B, et cetera, what to do? I know we're going to be putting out quite a bit more information in the near future, but what should people do if they want to know about their parents or if they qualify as a essential worker, et cetera?
Yeah, that's a really good question. We were just notified today of the expansion of 1B, so we're probably not going to be able to answer that today, but hopefully in the next week or so, we're going to have answers for you as we have guidance rolling out to us finally.
Thank you. We've got a question actually on the immunization clinic today. Most of our staff completed the notification survey. Some of the home care staff were notified and received the vaccine. Most have not yet been notified. How are individuals selected for these first vaccinations? Where can we expect to hear for the rest of our staff to be vaccinated?
Yeah, great question. So we do have a survey out for a notification survey for individuals who fall into that outpatient healthcare worker 1A and 1B groups. What we did with the survey is we asked a series of questions based on their risks, their occupational risk. Were they at high risk? Are they spending time with COVID patients for 15 minutes or more in a 24-hour period? Are they performing aerosolized generating procedures, meaning endoscopies and those types of procedures, respiratory procedures? Those individuals were then, if they identified as yes, they were then identified as phase 1A healthcare workers, and they were prioritized first. And then the second group, we have started to notify our phase 1B group, and those individuals are starting to get vaccinated. So just keep patient. We're running a clinic next Tuesday, and notifications have gone out. Our clinic did fill today, and we hope to fill the clinic next Tuesday as well. So we're as we get more vaccine in, we're hoping to roll it out as fast as we can. So I just ask for everyone to be patient. We'll be notified.
Thank you, Indira. Dr. Rubino, this is probably for you because you answered a similar question just a minute ago. Do we know how long immunity lasts after the second vaccine, given that it seems to only last 90 days if you have been sick with COVID-19?
Great question. That's still unknown. We do know that it's likely that the natural immunity seems to wane quicker, and it probably has to do with the viral load of the infection. The more virus you have in your body, and your abilities to fight off the infection really change how long you can be immune for. We do know that the current two vaccines that are licensed, Moderna and Pfizer, stimulate the antibodies and your entire immune system. So that's likely to last longer. We don't know yet. We're hoping to know as we continue these clinical trials that Indira talked about earlier, because these clinical trials on these two vaccines are still continuing. They're going to be testing these folks for a while to see how long those antibodies last in their system. So we're going to know about that more. Again, both Indira and I have said a couple times already, this is a new virus, a new vaccine. So just follow along and we'll hopefully be able to answer that question over the next months to a year.
Thank you. This one's for Jeff or perhaps Kate. Is there any enforcement of the rules of mask wearing and social distancing?
Yes.
Kate, go ahead.
Awesome. Thank you, Jeff. Yes, there is enforcement by public health for mask wearing and social distancing in public indoor spaces and at businesses as required by public health orders. Public health primarily enforces public health orders through education and will escalate enforcement action as warranted, which may include conducting outreach to individual businesses, issuing written warnings, notices of violation, and initiating legal action if needed. Given how heavily we rely upon social responsibility for mask wearing and social distancing as a disease mitigation measure, public health strongly encourages residents to continue to do the right thing by wearing masks and social distancing as much as possible. And I went way too fast with that response, so please let me know if it would be helpful for me to repeat it.
Thank you. I've got a few more vaccine questions here. One is it known when the vaccine, is it known whether the vaccine helps eliminate the long haul COVID systems that we're seeing in some patients?
I'm happy to try that, Andrea, if you'd like. So first, let me explain what long hauler syndrome is. Essentially, what has happened with this COVID virus, if you recover, many people have ongoing symptoms of disease. Some people have chronic headaches. Some people feel these aches and pains over their body. Some people have a heart condition called myocarditis, and other people have blood clots. And some people actually have shortness of breath and fatigue. So that's what we call long hauler syndrome. Now that's if you get the infection itself. It's likely, although we don't know yet, that if you get the vaccine, because you're stimulating your body's immune system to fight off the infection, you won't get the infection. Or if you get the infection, the symptoms are mild. So that therefore, those long hauler symptoms of the disease process itself will actually be prevented. So I know that sounds theoretical, but that's the goal of vaccinations, is to prevent you from getting serious complications, and long hauler syndrome fits into that category.
Thank you. Another vaccine question. Is there any new information yet or a timeline on vaccinations for children?
Yes, so I think I shared in the very beginning, we talked about those clinical trials, and there was that clinical trial phase 1, phase 2, and then phase 3. So what they'll start doing is clinical trials for children 12 to 18, in which they'll be doing what's called phase 2B trials. And what they'll be looking at is first they're going to monitor how things are going with the adult population. Then they'll engage in these phase 2B trials for 12 up to 18. And that's because we want to start with older children first. And so it'll be a modified, smaller clinical trial, but it will be targeted to that age group. And then if they find that it's very effective and safe for that age group, then they'll start moving downwards towards the younger age groups. So more to come on that. Children, they're in a developmental phase of their lives. And so, it's just going to take a little bit longer to learn more. Anything more to add, Chris?
And Dara, could you comment on pregnant women, immunocompromised folks, and breastfeeding in terms of their inclusion in clinical trials as well?
Yeah, so pregnant women are often what are called universally excluded. And what that means is that they don't necessarily ask for pregnant women to be included in clinical trials. Now, during a clinical trial, you could find out you are pregnant, and then they're going to monitor you for any side effects. So it's very possible that some of the clinical trials included some pregnant women, but it's a group that's universally excluded. It's not always the greatest thing, because we know that pregnant women, if they get COVID, if they have a high risk exposure for work or something, if they get COVID, they could get really, really sick, and that could be very detrimental also. So it's always up for a pregnant woman to talk to their provider about whether they want to get vaccinated or not. And just letting you know that immunocompromised individuals were included in some of the clinical trials, and it has been recommended that they do get vaccinated, although their immunocompromised status may impact the efficacy of the vaccine. But so that's something that they're studying as well.
Thank you, Indira. This one's probably for Jeff. Since teachers have been moved up to stage 1B of getting the vaccine, wouldn't it make sense to stay in remote learning until they can get vaccinated? That might be a month or two from now, and it would keep teachers much safer.
Thanks, Mike. Thanks for the question. And we're actually going to talk about this on next week's call as well, so I'd encourage people to tune back in. But the short answer to that is we don't know exactly when teachers will end up getting the vaccine. And as a reminder, there is a follow-up. It takes 2 doses in order for teachers to get fully vaccinated. And what we know from the data right now, again, lots of research from multiple places, validated this again with new information this year as well, is that in that youngest age group, especially 0 to 10, very little risk of transmission from kids to adults, very high negative impacts associated with significantly decreased learning in those students. So we know that it makes most sense to have those kids in class directly and learning directly. That is, we are also, I think, as you probably are aware, we've recommended a hybrid in-person from 6 through 12 so that there is more social distancing. We know there's a little bit higher risk associated with transmission the older the kids get, but in that 0 to 10-year-old age range, it's very low risk.
Okay, thank you, Jeff. We've got a question here asking, are COVID tests in Boulder County being genotyped?
I don't believe so. I think that what I heard was from our lead epidemiologist, Carol Hellwig, was that even the new variant strain wasn't even being tested for until December 20th. So unless, Chris, you might know a little bit more.
No, I think a small sample are being tested. So I would assume that most of the samples in Boulder County are not genotyped. So, but as we talked about earlier, in my opinion, the same prevention strategies that we've talked about all along are going to prevent you from getting the infection, whether or not it's a mutated or variant. I know that sounds a little bit paternalistic, but you can use the same prevention strategies to protect you from that. And also, we're confident, at least for now, that the vaccine will also cover any variant.
Thank you. We're about out of time. We've got one more question we'll get to, and then I'll give Jeff a few minutes to wrap up. If you did not get your question answered, you can email us at healthinfo@bouldercounty.org, and we will work on getting you an answer. This question is it possible to get tracking numbers on the vaccine? Things like the number of doses received, number distributed, number of residents in each group, 1A, 1B, et cetera, and broken out by state and county, a way to track progress.
Yeah, so the state health department has started to initiate some of that tracking, but it's at the state level. And so I think as they get more teams on board to help with their data monitoring, they'll hopefully be able to do that. We're interested as well because we have vaccinations that are going out through our hospitals and our federally qualified health centers. And so we want to see how many doses are being administered. So keep monitoring the webpage of the state health department, and hopefully we'll be able to get some county specific data soon. Thank you.
Thank you, Indira. And Jeff, do you have anything to add as we wrap up this session?
I just want to thank everybody again for tuning in with us. Really, it comes down to that last slide that Indira had, which indicated so well that we can save people's lives. We can keep our businesses open. We can keep our kids in school. We can make a huge difference in people's quality of life. We have some more months to go, so please do continue to do what you have been doing over this Thanksgiving holiday, which is following those recommendations, because if we don't do it, then we know it's not going to make a difference in terms of what we put in place if people don't follow those. So thank you for hanging in there. This has been a horrendous year for all of us, and I know that. And again, appreciate all of you continuing on with us. We can make a difference in this. So please, spend the time over your New Year's with just the ones who are under your household. We'll get through this together, and our numbers will continue to decrease. Thanks to all of you, and have a happy and safe New Year.